Good morning, everyone. Welcome to Resilience During COVID, From Crisis to Opportunity with Dr. Bruria Adini. My name is Craig Walters, co-chair of UJA's 2021 annual campaign, along with Leanne Matlow, the founder of Mental Health Empowerment Day. Today's special event is presented by Canadian Friends of Tel Aviv University, Mental Health Empowerment Day, and UJA Federation of Greater Toronto. Over the next hour or so, Dr. Adini will be presenting to us on the importance of mental health, why it should be a priority, especially during times of anxiety, and how to turn that stress into opportunity. Because of the COVID-19 pandemic, feelings of loneliness, sadness, and depression have increased. It is so important to seek out help if needed and to know that you are never alone. I would now like to turn things over to the chair of the board for Canadian Friends of Tel Aviv University, David Altshuler.
Good morning. On behalf of the Board of Directors of Canadian Friends of Tel Aviv University, I would like to welcome everyone to this morning's webinar. Dr. Adini is the head of the Department of Emergency Management and Disaster Medicine at Tel Aviv University. She's involved in the field and academic activities targeted at preparedness and response to varied risks that may result in mass casualty events and/or disasters. She's a board member of the local authorities confronting disasters and emergencies and the Israeli National Council for Trauma and Emergency Medicine, and a former member of the World Association for Disaster and Emergency Medicine's board. Dr. Adini researches various aspects of emergency management, including advanced methods of evaluating capacities, perceived risks, resilience, and utilization of social media and emergencies. And with that, I welcome again Dr. Adini.
Thank you very much, David, and thank you everyone for the opportunity to spend this Sunday with you, at least a short version of it. And I would like to share with you a journey that we've been taking here in Israel, but I believe that this is a journey that actually many of us have experienced in all our aspects of life, in the family life, in the community life, concerning societal resilience, our nations, and actually the global community. So sharing these insights and the experience and what we have learned is something that can make all of us provide a more effective response to everything that we've been seeing, feeling, experiencing in this past year since we started the COVID-19 pandemic. And I would like to share some of the things and the insights that we have learned in this past period. I would like first to ask all of you, the last thing I would like this to be is to be a lecture, because I think we can enrich each other. So since we're not a few people in the call, unfortunately we can't all speak at the same time, but we certainly can put in comments and questions in the Q&A. Please feel completely free to do so throughout the presentations, and also, of course, afterwards we'll open it for a Q&A, because we want to understand each other and all of us to contribute to our joint learning experience. I would like to focus in the next few minutes on several elements of our resilience, including the strong elements such as empowerment, a feeling of trust, being confident in what we're receiving and what we're able to provide, but also some negative elements such as fear, anxiety, depression, and other elements such as a sense of threat and insecurity. I'd like to start with just an overview of who are the stakeholders that are involved in the COVID-19 crisis. So regardless of what country, and certainly in the global community, when we look into who are the actors that are involved, we would say the governance systems, the different ministries, the local authorities, other types of authorities that are in charge of providing a response and trying to actually manage the pandemic. The healthcare systems, both in the level of the emergency medical services, the hospital, the primary care providers are very much involved, as well as the international bodies, the World Health Organizations, the United Nations, and many other organizations which actually function on an international level. But there's one more very important stakeholders that sometimes we don't take into consideration enough, but they're a dominant component, and that is the population. The population is an intrinsic component of anything we try to do concerning managing of the COVID-19 crisis, and I would actually like us to focus now in the next few minutes on the civil society, on our respective populations. So when we look at the population and we try to ask ourselves, what does the population constitute in relation to the management of COVID-19? Are the people a challenge? Do they pose a problem? Or are they actually a component of the solution, an entity that we have to take into consideration as a partner to anything that we try to do? So I'm going to go back to this question at the end of my brief presentation, and hopefully all of us will reach more or less a consensus on which one of these elements or all of them the public constitute. Now, why am I showing you these two pictures? I'm showing the small children because in Israel, today actually is the first day that we are starting very gradually to come out of the third lockdown. If we count all the months that together we've been in lockdown, it's been over 4 months. And for most of that part, and even more than that, the children have not been going to school. So is that a challenge or is that a problem? And I'm showing you another element that certainly poses a very big challenge and also a very complex problem. When we're stating, for example, in the restrictive measures that people should not go into any mass gatherings, but only last week, when we're in the midst of what we're calling a very restrictive lockdown, we can see here in the same day there were 2 funerals in Jerusalem of prominent rabbis, and thousands of people very close together actually attended these funerals, and there is no doubt that that will have an impact on the level of infectivity, regardless of what the directive was, not to have any such gatherings. So when we're looking at populations, we cannot disregard the element of resilience. Resilience, and I'm showing you here just one study that's been published, but there are many that have focused on this very important element. We know that resilience is important in order to achieve the community engagement. What we mean by that is the adherence of the civil society to all the regulations, to the rules that the government or other authorities try to apply in order to maintain the public health and the safety of the population. And it doesn't matter if it's social distancing or home isolations or wearing masks or overall lockdown. We need the population to be resilient in order for the population to adhere and comply with all of these regulations. So what are we talking about when we're referring to resilience? And we usually look at different levels of resilience, individual, community, or societal, or some call it national resilience. What we're actually referring to is the ability to overcome the challenges and bounce, not even bounce back, but now we're saying bounce forward, recover from all of these challenges and continue to function in a most effective way. And this is needed both on the level of each person, thus the individual resilience, the community resilience, which is the neighborhood that I live with, or sometimes the community that I'm affiliated with. It can be according to ethnic affiliation or religious affiliation or other such as professional community and so on. We want the support, the ability to function well and have the community support us in this. The third level is a level of the country, how we trust our leaders, how we actually believe that what they're trying to do in the public institution is to provide a response to our needs and our expectations, the level that we feel connected to our society at large. So the first thing when the COVID started, and in Israel it started, we had the first cases in the end of February 2020, the beginning of March, we understood that what we need to see is actually if there's any change in the level of the resilience that we knew was characteristic before the COVID-19 versus what was happening in March 2020. And we initiated a study, and what you can see here, we actually look at two main things. We look at the level of the negative elements, such as levels of concern, the perceived threat, the distress symptoms, and so on. And when we try to compare the level that was characteristics before COVID-19, and we were lucky enough that we initiated studies before in 2018, so we had the baseline level. And what we saw that in 2020, when the COVID started, both the levels of concern and the distress of the population, feeling uneasy, feeling having problems of sleeping, being agitated, and so on, these symptoms in our population increased. We saw something interesting also concerning the resilience. The individual resilience decreased. That was a result of the perceived threat and the insecurity, because the COVID was something that we were not used to, we weren't accustomed to it. Most of the population didn't know what to expect. The community resilience actually increased. And this is something that we've learned that is characteristics during adversity. What happens to people in different societies, I don't think this is characteristic only in Israel, it's also characteristic in many other societies, is that when there is some crisis, we'll look for support from our community. And thus, we tend to feel more secure and feel more confident in our community. And this is why the community resilience actually increased. The societal resilience stayed the same. So we still didn't know what to expect of the society at large, the government, and so on. And it remained at the same level, a relatively high level, as it was in 2018, also in the beginning of the COVID. So the first thing we had to ask ourselves, how can we explain this? And as we've said, one of the elements we wanted to see, what are the people afraid of? Are they afraid of the virus? Are they actually feeling threatened by other elements? And what we found, which was pretty surprising, was that the virus itself was not the element that caused the fear and the anxiety of the population. The two main risks that were perceived by the populations were the political risk as well as the economic risk. Now, we need to take into account Israel is now, right now, when we're speaking, is in the midst of a fourth election within a period of less than 2 years. So the instability of the political leadership is something that concerned the public in Israel to a very large extent, because the first thing you ask yourself, is the government going to actually provide the good response? Can I be calm that they're taking care of my needs, my expectations, that they are going to provide an effective response? And this is why we believe the individual resilience decreased while we still looked for support from our immediate community, and that went up. Now, very quickly, after March, we understood that the COVID is not going to be something that was very short-lived. It's going to be a prolonged crisis. And so we initiated longitudinal study, and every 2 or 3 months during the pandemic, we measured again the same cohort of respondents that represent the population in Israel. So we started with 1,100 responders. In the fourth measurement, which was just in January last month, from measurement to measurement, there is some a dropout. We still have a very large cohort of over 700 responders. And what did we find? We looked at the population in May. May was the time after the first lockdown where the communities have started to go back to what we thought was normalcy. We believed, and that was what was transmitted by the leadership, that the pandemic is now almost going to be completely over. So life was going back. And we measured again in July, when again the levels of infectivity rose to a very large number, and there was talk about restrictions once more. October, we were already in the second lockdown, and by January, which was the fourth measurement, we were in the third lockdown. But something else happened at that period of time. At the end of December, the vaccination campaign was launched in Israel. It started more or less since Christmas, and there were two main things going on in parallel. One was a very strict lockdown, which, as I've said, lasted a month and only is beginning to be lifted very, very gradually today, as well as the vaccination campaign, which we wanted to see how both of these elements actually impacted on the population. So we see two different trends. Concerning the individual resilience, what we saw that there was a gradual decrease from May through July to October, but a very significant drop between October and January 21. So the people are already feeling what we call pandemic fatigue. They're fed up that the children are not going to school, that they don't know what is happening with their livelihoods. They don't know when life is going to go back, when they're going to be allowed to visit their friends and go to theater, and so on. The national resilience, we see something different. We see a very steep decrease from May to October, but we're starting to see some slight increase, and this is most probably due to what is happening with the vaccination. So even though we're in third lockdown, the feeling that there is some hope is affecting here, and I'll show it to you in a minute. And we see that the same a trend with the community resilience. And remember what I told you before, usually during adversity, the community resilience is high. What happened in the COVID, which is completely in contrast to other types of adversity, we couldn't use the community as a support system because we are being told, stay at home, you cannot see friends, you cannot go to any place where you can gather with other people. So the community actually is much more challenging to perceive it as a supporting mechanism. Now, what did that do to the anxiety and the depression and the sense of danger of the populations? We can see by October 2020, 1 out of 3 people displayed high symptoms of anxiety, which means 29% to 30% of the population displayed high symptoms of anxiety versus 9% that did so in 2018. So you can see a very significant increase in symptoms of anxiety. The same we see regarding the symptoms of depression. So this is something which is very, very concerning because it means that it impacts on the function of people, both at home, with their families, in the community, in their place of work, and so on. The function is actually affected in a negative way. And when we looked at the trends, we can see both concerning the sense of danger that rose from May to July and started to somewhat decrease in the last 2 months. We've been getting used to the threat. It's something that we either use denial, or we say, okay, we know that, we've been well up to now, so this begins to decrease. The same we see with the anxiety, but the depression, the decrease is much less. So this is something that we know that we need to take into account and provide a response to. I want to show you the complete opposite. What happens with the hope and morale? Now, what is the big difference between hope and morale? Morale is what we're feeling right now. It concerns with our present, what my life is at this point of time. And we can see here that there was a decrease between May and July, even to a somewhat degree in October, and it stayed in the same status. Our lives still hasn't changed. It hasn't got better, but the hope, we see somewhat different trend. The hope, we can see that from October, again, when the vaccination already started in December, so by the measurement of January, we see that the hope is actually taking some other turns, and people are beginning to hope that the future is going to look better. Now we have something to look forward, something that actually empowers us and makes us more positive when we think of the near or the further future that is awaiting for us. Now, you remember what I showed you before concerning the threats, that the economic and the political threats were the ones that were most dominant. So we wanted to see if that continues, and we continue to measure that throughout the crisis, and we saw that the same type of trend continued. The political threat to this day is the highest threat perceived by the Israeli public, and the average is much higher than both the economic as well as the health threat. So if we, for example, thought that what worries the public is the virus, the infectivity, being afraid of our health and our even being able to maintain our normalcy of functioning health-wise, that's not what concerned the public. The economic threat somewhat decreased because of the measures that the government took to ensure that people, we have over 1 million people in Israel out of a population of 9 million that is out of job, that is unemployed due to the COVID-19. Israel never knew such high prevalence of unemployment, but the compensation, which the population knows that is going to continue according to what the government promised up to June 2021, that gave some confidence, and this is actually what contributed to this decrease in the level of the economic threat. But the political threat is still very, very high and still concerns and causes within the Israeli population a big rift within the population. Now, a big rift during a crisis, which poses so many different challenges, is something which is very, very worrisome and needs to be dealt with in order to make sure that our society can function well once more. I want to share with you to delve in concerning two more elements of the data that I've showed you. The first is differences concerning genders. Now, when we look at women versus men, when we look at the negative elements, such as the perceived threat or the sense of danger or high levels of depression, we can see that among women, these concerns actually are reported with higher scores by women compared to men. The resilience, both the societal resilience and the individual resilience, we see the opposite trend. Men versus women report higher levels of resilience. Now, I have to tell you from other studies that we have been doing throughout the years that these trends are pretty characteristic. Resilience usually is reported by men as being higher than women. I'm not sure, and it's very hard to actually understand whether this is due to the fact that men really are more resilient than women. It can also be due to a bias that men, concerning masculinity, don't want to report or feel that it would be a weakness to report low levels of resilience, versus women that are less afraid of showing weakness or concern and so on. So we only know for certainty that the scores are different between the two genders. Why this is the case is a bit more challenging. I want to share with you another finding that was pretty surprising for us. We all know that when we look at the risk population, the older populations, 60 years and older, they are the riskier group of people because when they are infected by COVID-19, it's usually in a much more severe way, and it also can actually be fatal in large numbers and so on. So we would expect that they would be more concerned and that their level of resilience would be lower than those of younger people. But what we found was the complete opposite. The younger people, especially the group of 31 to 40, they were the one with the lowest levels of resilience and the highest levels of concerns, both sense of dangers, depression, anxiety, and so on. So it's interesting to see that. And we asked ourselves, why is this the case? Because we expect the 31 to 40, they're the backbone of society. They're the ones who have children who go to school, and they don't know what's going to happen to them and what is going to be the future with them because the education system is not functioning appropriately. They're the ones that are the backbone of the economical arena. They are in the midst of their career and so on, and now this too is unstable. So this is most probably the explanations why they showed much lower levels of resilience and much higher levels of concern versus the ones who are already in pension, for example. Their salaries have not changed. Their level of living, quality of life, in many ways, certainly the economic elements, did not show any significant difference. And so they actually have a higher level of community. I want to share with you concerning this phenomena, an experience that I personally experienced in the past. This was in the Gulf War. It was in 1991. I was, for many years, I've been a senior consultant in the Ministry of Health on emergency preparedness. And I remember to this day, the city of Haifa was a risk area. And the father of the Director General of the Ministry of Health lived in Haifa. He was 90 years old. And I remember the Director General, it was Professor Avi Israeli, said that he tried to persuade him to come back to live with him in Jerusalem because Jerusalem was considered to be a very safe city. The missile attacks that were launched against Israel were not launched towards Jerusalem. It was mostly to Tel Aviv and Haifa. And I remember to this day the answer of the father. He says, I'm not going anywhere. I'm staying in my home without a shelter in the third floor. And Avi asked him, why is that? He says, you know what? I've had so many adversity in my life. I survived them all. I'll survive this too. I think this is something that also explained to us what happens and what actually characterized the older population. They feel this confidence because they've had so many experiences that actually increased their resilience and allowed them to be able to also overcome the current adversity. Before I conclude, I want to share with you two more elements that we wanted to do that we actually initiated during this pandemic. We didn't want to stay only in a theoretical level. We wanted to find solutions that will help to cope and manage the pandemic. So one of those initiatives was a training video. This was done in coordination with our Magen David Adom, which is the emergency medical services in Israel. And we designed a very short 6-minute training video on what COVID is all about. We then had a study to see what would be the impact of this film on the population. And what we saw when we showed them the film and measured their resilience before and after watching the short film, we saw an increase both in the knowledge of concerning COVID, the perceived knowledge, the feeling of safety and feeling protected, as well as the resilience. We're doing the same now with the vaccination. Again, a very short film, and we saw similar results. You can have very simple measures that can have a significant impact on the populations. We also looked at something else. What would actually enhance compliance? Because we know that the risk communication campaigns that the government issued for a long time was a fear campaign, telling us how serious the COVID is and how it may cause the death of many people and so on. When we researched what actually enhances compliance of the populations, we found that we need to do something completely different. 63% of the population believe that staying at home and will protect themselves or their family. And the feeling of solidarity of protecting my family, that's what we need to do. And that will empower them to stay at home rather than tell them, you're going to get a very high fine if you go out of the house. Out of your house, you can see that this impacts only on 18% of the population. We also asked the complete opposite, what will impede compliance? And what we saw that the fear of the economic loss, that impacted on more than 30% of the population. So again, this type of collaboration between the academia and the field is something that could provide important input for the government in order to change the risk communication to empower the population rather than try to instill fear. I want to complete with one element before I go back to the question of what does the population constitute. The question is who should manage the COVID-19? So when it started, not only in Israel, but the World Health Organization said, well, this is a public health event of international concern, so of course the health professionals should be the ones that manage the crisis. But is that true? Is that only a public health event? It's also an economic event of international and national concern, a societal event because it impacts everything that has to do with the society. And it's also, as we can see, a political event, not only in Israel. We can see how it impacted on the elections in the United States. We see it also in European countries, in South American countries, and so on. So it's clear that the management of such a crisis has to be done as in collaboration with all the different fields, and it's not only a health crisis. So I want to complete by going back to the questions of what does the population constitute? Is it a challenge? Is it a problem? Or is it a component of the solution? I hope that you agree with me, at least my opinion is that we need to make the population a partner in what we're doing, and only then can we be successful in what we're doing. So I would like to actually, leave you with a message that I truly believe in, that since the COVID-19 doesn't in any way recognize borders, it doesn't see any separations between communities and society, neither should we. And the main thing that we need to do is share our insights, our inputs, our experiences, because only then can we actually make our society more resilient. So I want to thank you for the opportunity for this morning, and I invite all of you to share your inputs, comments, questions, so that we can relate to them. And with your permission, since they're coming in the Q&A, I will present the questions that have been raised and provide the input. So the first question or the first comment is from someone who is anonymous that wrote, I think people who have less connection to a fast-moving society and are far from their children and grandchildren will have an easier time to isolate. I have to tell you that I actually think that people that have less connection to societies are feeling much greater levels of loneliness. Loneliness very much is correlated with depression and other negative elements rather than increased resilience. And when we see that the resilience go down, the adherence also decreases. They sometimes have, the tendency to say, well, I have nothing to lose anyways. I'm here by myself. No one is here. No one really cares. Sometimes there's even concern, especially among people who are not healthy or are elderly, saying, well, I'm going to, depart from this world alone. What is this actually been worthwhile, and so on. So I'm not sure it's a really easy equation to answer how it impacts on the different population. Another question from David Matlow, saying that in Canada, we're many months away from vaccines. We believe our government has let us down. How do we keep up both hope and morale until September or so when they say we will all be vaccinated? I completely understand and share the frustration. I want to say two things regarding that. First of all, I have to tell you in Israel that we have, I think we're the country that is most advanced concerning the availability and the accessibility to the vaccination. And up to now, from the 9 million people that have been vaccinated, approximately 3.4 million people have been vaccinated. Among them, over 2 million have already had the second vaccine. But this and almost 85 to 90% of those vaccinated are in the risk population, so that we expected to see those numbers already impacting on the level of infectivity. But what happened is something different, unfortunately. We saw two main phenomena. One, people are less inclined to come now and be vaccinated. So at first, in most societies, there are 25% that believe completely and are very confident about the vaccines in general, not only the COVID, and they go very quickly. They're the ones that are the first to be vaccinated. Then there are 50% that say, okay, I think the vaccines are a good idea, but I'm going to wait and see what happens to those 25% that went and were vaccinated before me. And there's something like 20-25% that are very cautious and may think that they actually are not afraid of the COVID. They're more afraid of the vaccine than the COVID itself, and so on. And they will not come to be vaccinated at all. Now, we know that if we want herd immunity, we need very high numbers of vaccinated people. We're very much far from that. And despite what we saw with the vaccination campaign, the levels of infectivities have not been going down, even though we were under strict lockdown. So the frustration is shared also by our community. So here too, it's not mathematics. It's not a right and wrong answer. I believe when you're concerning your question, and this is the second element, how do we keep up hope and morale? I think the main element is the trust. What is the level of trust of Canadians in their government, in the federal government, in the provincial government, in their local authorities, and so on? What is their level of hope that they're doing everything that's possible to actually manage the pandemic? What is the transparency concerning information? How do we trust the information that we're getting? This is not less important than the vaccination, because the data that is, is starting to get out there, that even Israel is not getting to be going back to routine lives, despite what we hoped for with the vaccines. So the measures are going to be continued. The same thing can be done. Look at New Zealand, for example. The level of trust there is phenomenal. The directives, the regulations that were issued by the government were in a very high level of adherence and compliance, and they're the first country that actually has gone back almost to routine. They don't need to wear masks, certainly not when they go outside. We have to wear masks everywhere. I don't know what in Canada regulations are concerning the different locations, but all of these measures, the restrictive measures, are going to be shared by most societies. There's a few, like New Zealand, that were really successful in doing so. Lenore also related to the element of vaccination. So I think, Lenore, what I've stated concerning David's question is something very, very similar. Another anonymous attendee asked, do you believe that this is universal? In a place like Canada, where the vaccination is not being implemented, would you expect different responses? I would expect a response that is related, as I've said, to the positive element, to the solidarity within the Canadian population, to the trust in the government, to our feeling that our governments, regardless if it's the provincial or the governmental, is actually looking after us. For example, what happened with the unemployment rates in Canada, and what did the Canadian government do in order to instill some level of confidence within the population that they're going to be catered for, and that they're not going to go into bankruptcy or not being able to buy food? Those are the questions that we need to ask before I can answer if what I showed you in Israel is universal. What I can tell you that is universal, and we've been doing many collaborations with other countries. We've done that with researchers in the United States, in Brazil, in Georgia, in different countries, in Australia. What we saw that the mechanisms work pretty similarly. That trust is always important, that the level of solidarity is very important. And there's one more element that we saw that also seems to be universal, and that is ideology. What we have found that people with strong feelings of ideology, and it can be a political ideology. For example, in Israel, it would be those that were more inclined to be right-wing, and we have a right-wing government. And those that are ultra-religious or are religious, they tend to have higher levels of resilience. They have higher levels in the government, and thus they have lower levels of concern, anxiety, or depression. So, for example, you should ask yourself, what is that level in Canada? And according to that, you can also map different populations, a different group within the populations that you would probably expect to find higher levels of the positive variables and lower of the negative ones. Rabbi Bodzin, I don't know if you wrote, I don't see a questions, but maybe that was a question of the anonymous. So, here, a question from the rabbi. How does the political threat manifest during this time of vaccine? You know what? It actually impacts on everything, including the vaccine. Some people, especially the ones that have a very, very low level of trust in the government, are in some percentages higher than those with more trust in the government and more right-wing attitudes and opinions. They question the vaccine more because, the vaccine has not been approved as a vaccine. What has been approved is as an emergency measure. Nobody knows what the vaccine is going to actually show over time, because this is a new vaccine. We don't know what it's going to do over time to healthy people. We don't know what it's going to do to pregnant women. We don't know what it's going to do to children and so on, because first of all, we didn't have enough time to do the studies on that. We've only been a very short period of time for these studies to be initiated and implemented. And we also didn't have enough of those people within the study. For example, there weren't pregnant women within the study that was conducted by Pfizer or Moderna. What happened is there was a small number. For example, I think in Pfizer it was 23 women who didn't know that they were pregnant when they started the study, and found out they were pregnant within the duration of the study. So they they were continued to be monitored. But other than that, they didn't include such populations, such groups within the study. So when you have a lower level of trust in the government, or you perceive the political threat as much higher, it also impacts even on your trust of the vaccine. Murray has stated that I heartily concur with your comment that trust in the government and chief medical authorities is a very important reason why the population doesn't trust the Canadian and American authorities to tell the truth to their people. I want to say that I didn't comment on Canadian and American. I leave that to you. I can tell you that in my society, we do find it as a problem, and actually the level of trust in the Ministry of Health, unfortunately, has been going down, and this decrease is still in a linear level, the same trend. But at the same time, we can see, for example, trust in other organizations, for example, in Magen David Adom or in Homefront Command, some other organizations that instill higher levels of trust. And this, for example, is why they're being recruited more and more to be in direct contact as much as possible with the civil society. Murray continues saying that instead of the endeavor to put fear of Hashem in them and threaten fines or imprisonment if we don't blindly follow their autocratic and dictatorial mandate. I completely agree with you. I have to tell you that not only from the period of the COVID, but also from other types of adversity, we saw that what happens with fear, it impacts the populations, but only for a very short period of time. What happened in Israel, that when it started in March, and the government said, this is something that is fatal, and we were in March, and they said by Pesach, which is in April, we're going to see 10,000 people are dead. Thank God, by Pesach, we had, I even hesitate to say only 200, because even one is a large number, but the numbers were 200. So after that, the population said, well, they threatened us with 10,000 people, and we saw that only 200 died, and many of those were very elderly with different comorbidities and so on. So now I don't trust them as much, and I won't listen to them. And that impacted on the adherence of the population to the rules and regulations that happened afterwards. Now, when we had what we are calling the restrictive lockdown, the real reason why that lockdown has been lifted now is not only the debates between the political parties, it's also because the public actually what we call voted by the legs. I, for example, since I'm also a consultant, I was allowed to go to work and so on. I have to tell you that what I saw in the road was a very high load of traffic. So I didn't feel that there is really a lockdown, a tight lockdown and so on, which means that the public doesn't listen anymore. And this is one of the main reasons that the lockdown, was lifted. Annie has stated, as retired people who are self-isolating, we have finished waiting for the Canadian government to fulfill its empty vaccine promises. We just gave to wait and hope our turn will come. We depend only on friends and family for getting groceries and having supported conversation. Fortunately, we don't have to depend on government financial benefits given out for COVID. They aren't for us. The Zoom also has enriched our lives and made isolation from synagogue and family bearable. You're completely correct, Annie. I think this is something that is shared by many of the population. And I showed you before that even in the data that we have gathered here in Israel, the ones that are retired, in some ways, are less concerned and more resilient and other, and not because of the government or not only because of government rules and regulations, but because they rely on their neighbors, they rely on their friends, and this is something that has actually strengthened the solidarity and the community resilience, because you depend only on those that are very close to you. And if that happens, this is something that empowers the population and works in a much more important and stronger way to impact on the ability to weather whatever comes our way concerning the COVID-19. The last question is, what is the is it okay? Everyone believes that Israel is the blueprint on how other countries should handle the vaccine distribution. Is it realistic to expect that other countries will and can follow Israel model? I have to tell you that concerning crisis management, nothing can be adopted as is. Everything can be adapted. So we need to take elements or insights that we have learned as a good benchmark and try to adapt it to the specific society. One of the elements in Israel that has helped and been very much prominent in our success is the medical system in Israel. We have two main characteristics. First of all, everyone in the society is fully insured by a national medical insurance. I think this is something which is very similar in Canada. But the second and most important element is that we have very strong primary care facilities. So each one of the residents in Israel belongs to one of 4 health maintenance organizations that have many clinics and very strong clinics in the community. We usually go to the emergency department only when we feel that there's no choice. We first prefer to utilize the primary care services. And so these were the services that actually were the ones who were in charge of the vaccination. So first of all, there's a very high trust among the residents in reference to the health maintenance organizations, and also they're very much accessible and available. So, for example, for me to be vaccinated, I had to go a very short distance to get the vaccinations. I knew exactly who to approach. The number was out there, and the health maintenance organization actually did everything very easily and smoothly. I don't know if this can be replicated as such in all countries. I know, for example, in the States, pharmacies sometimes are the venues for doing vaccinations and so on. So each country has to actually modify it according to the specific facilities and system that is characteristic to its own society. So I believe I addressed all the questions that have been posed. I want to thank you again for this opportunity. It would have been much nicer if we could have sat in the same room and seen each other, but I think the Zoom is the next best thing. So thank you everyone for participating, and thank you Leanne and Stephen for this opportunity. And I would like to hand the mic or the screen now back to Leanne.
So thank you so much, Dr. Adini, for your insights, your expertise. I know I took notes. I love learning from experts. And 2 of the things, the words that you highlighted are really the fundamental words that we at Mental Health Empowerment Day, which is a not-for-profit that I began 4 years ago to spread 3 messages, which actually were core messages in your talk today. The idea of building community and the idea that we need to work together. And I loved your message that as a community, I love the idea that community resilience is actually stronger than individual resilience. And that obviously touches on the fact that I want to thank so much Craig Walters, my co-chair for the UJA campaign of 2021, and for Stephen Adler and David Altschuler from the Canadian Friends of Tel Aviv University for helping us spread this message of community, for sharing insights, which, as Dr. Adini pointed out, is really the thing that's going to get us all through. At Mental Health Empowerment Day, we stress the idea of education, as education is the way to get power to help solve problems, to build community, and to end stigma around topics of mental health. So we continue to invite all of you to reach out to us or check us out at our website, www.mhed.ca. Again, thank you so much for taking time this Sunday morning to join us. Thank you to Stephen Adler for being a great partner for UJA, Natalie, and all the staff who helped us organize this. And I wish you all safety. Let's hope that we too will be sitting here saying, I have both vaccines very soon. And let's all work together to get out of this in the best possible way. So thank you. Have a great day. Enjoy the Super Bowl and take care of yourself.